Hello, thank you to Path Library for this online slide. And I'm doing this unknown in real time with you all, so I might get it wrong. Let's look at so this is a uterus case. 65-year-old female, uterine bleeding, uterine mass. Okay. All right, so what I see here is, well, let's get my orientation straight. Let's see, where's endometrium? So I believe this is endometrium. But this does not look like serosa or like the serosal end. So I'm not really sure how this is oriented. We have some regular myometrium here with vessels. So I don't think this is endometrial cancer, right? Because we don't see any glands. And of course it can be like a very dedifferentiated endometrioid cancer, but I don't think the cells don't look ugly enough for that to be the case. Okay. So maybe this is endometrium. I mean, she is postmenopausal, so the endometrium is going to be pretty atrophic. So my first thought is endometrial stromal sarcoma, which is sarcoma of the endometrial stroma. Then you would get a CD10, cyclin D1. Cyclin D1 I think can be seen in high-grade endometrial stromal sarcomas. Your differential would be like an endometrial stromal nodule. That you would have less than like 3 tongues of 3 centimeters of just endometrial stroma, and you wouldn't have any lymphovascular invasion. High-grade endometrial stromal sarcoma, the cells look more high-grade. I think you can do a mite count, and there's a threshold for myxoid or never mind. But yeah, let's see what stains were done. SMA, positive in the nodules of cells with more abundant cytoplasm, negative in the majority of neoplasm. Positive in the nodules of cell. CD10, positive in all tumor cells. Okay. WT1, positive in the majority of cells, negative in the nodules of cells. Cyclin D1 is negative. B-core is negative. Oh, B-core is another one that'll tell you if it's a high-grade endometrial stromal sarcoma. ER should be positive. This is, okay, patchy nuclear positivity. Cytokeratin, focal weak positivity, and H-caldesmin, positive in the nodules of cells. So let's look at the hint. Tongue-like invasion is characteristic of this diagnosis. I did mention like tongue-like, like worm-like invasion. So yeah, this is low-grade endometrial stromal sarcoma with smooth muscle differentiation. That I did not catch, but I guess you can see that right here. And that's why those areas would stain with smooth muscle actin and desmin. Let's read a little factoids about this. Low-grade endometrial stromal sarcoma show characteristic tongue-like invasion, monotonous ovoid to spindle cell proliferation. A whorl or concentric growth pattern around blood vessels is often seen. Let's see if we have that. Maybe this whirling. Oh, here. Whorl or concentric growth pattern. Nodules of bland appearing smooth muscle are interspersed within the spindle cells. This represents smooth muscle differentiation within the tumor. By IHC, most cases of low-grade endometrial stromal sarcoma are positive for CD10 and WT1. Estrogen receptor is usually positive as well, but may be patchy. Differential diagnosis. Endometrial stromal nodule, a maximum of 3 protrusions into the myometrium are allowed, and none can exceed 3 millimeters in depth. LVI is absent. High-grade endometrial stromal sarcoma shows high-grade atypia and an elevated mitotic rate, negative for ER and positive for cyclin D1 and or B-core IHC. Let's do practice questions. Ooh, low-grade endometrial stromal sarcoma has this like jazz hands. That's my mnemonic to remember that. High-grade endometrial stromal sarcoma will have like B-core and a couple of others that I don't remember off the top of my head. Okay, JAS-F1. JAS-F1 sus12 is the most common. A high-grade endometrial stromal sarcoma, YWHAE nut M2A fusions. You can have B-core rearrangements as well. Okay, low-grade endometrial stromal sarcoma is a malignant neoplasm arising from proliferative phase endometrial stroma. Smooth muscle and sex cord element differentiation may be present. Besides that, it is cytologically monotonous, typical of translocation sarcomas. Remember that tongue-like growth pattern is usually seen in endometrial stromal sarcoma. More than 3 myometrial protrusions, or any protrusion greater than 3 millimeters, is diagnostic of low-grade endometrial stromal sarcoma over endometrial stromal nodule. All right, y'all, that's it for today. I'll see you tomorrow.